I have a question about nuts. I kind of forgot, like there was a group of nuts that were either tree nuts or ground nuts. One of those were not the good ones that are good for you. I'm trying to
Well,
remember.
the ground nuts, like peanuts and things, you have to be careful of different fungus and aflatoxins and things in those. So that's the biggest thing for those. Soaking them will help with that. I know some nutritionists that say peanuts were never supposed to be consumed by humans. I don't take that hard of a stance. I do think they are a food, and yes, they do carry different molds. You have to be careful of that, especially if you have some mold issues, or people that have Lyme should probably have to be much more conscious of that. People with cancer, that's not a bigger issue unless mold or something like that was the driver of your cancer.
But is it like the toxicity or something that could make make it unhealthy in general for
Well,
people to
it's really the molds in it that can make it unhealthy in general for people. But then you go, okay, should I stay away from peanuts because they have mold in them and I could end up with mold issues? Or the little bit of mold in a peanut, is that necessarily bad? Could it be stimulating my immune system to create antibodies against mold so I actually have a greater tolerance to mold? See what I mean? You can balance that out. Not everything that is bad for you is necessarily bad for you in small doses.
isn't there mold in mushrooms then too?
There are, yep. There's mold in mushrooms. So if you're eating mushrooms from the store, some people that have mold issues and Lyme issues, so they have biotoxin issues, I have to take them off of mushrooms, off of peanuts, off of anything that can have mold in them. But a healthy person does not have biotoxin issues. Eating mushrooms can help stimulate the body's ability to develop antibodies to that substance. It's the same. It's the same theory that is not a theory. It's a proven fact of why the thought that vaccines would work. If we give a small amount of the substance, let's say the measles, to the person, and they stimulate, it's enough to stimulate a Th1 and a Th2, which is a B cell reaction in the immune system, that then they'll create antibodies against measles. Now they'll have immunity to measles. The problem comes in is that when you put it in a little vial, and how much are you going to dose that person with that amount of measles? If you give them a little too much, they're going to get a full-blown case of measles. And now you didn't help the person, you just gave them measles. If you give them too little, then it doesn't stimulate an immune response to the measles at all, and they don't create antibodies. So then what they did with vaccines is they said, well, we'll put an adjuvant in with it. And that's why they put formaldehyde, mercury, aluminum, and all this crap that you can't pronounce, all these different chemicals. Those are adjuvants that they have to put in that vaccine because they put such a small amount of the measles in there that no one would develop antibodies against it. But when they add the adjuvants as well, then in a greater percentage of the population, it will stimulate an immune response, and you're not going to develop antibodies against mercury and aluminum and propylene glycol and formaldehyde, but you'll stimulate an antibody against the living organism that was accompanied with that vaccine. In this case, we're talking about measles. So then you hope that they develop antibodies to measles. And if you develop antibodies to measles, and you have circulating antibodies to measles, now when you're exposed to measles, you won't get measles because you have antibodies against it. Your immune system will be more readily to kill it. That's the whole idea with a vaccine. The problem is it just doesn't always work that way. So the percentage of people that actually develop antibodies to the thing that they're vaccinated against is actually quite small. So all you're doing is exposing people to all these toxic adjuvants And if they have detox pathways that are blocked, those toxic adjuvants can settle in the brain, can settle in other tissues, and cause other problems. And that's what's going on with vaccines. However, you're basically vaccinating yourself against bad things by exposing yourself to bad things in small doses. Hence, the benefit of teaching your kids to go out and play in the dirt like you did as a child is very beneficial because they're exposed to bacteria and toxins and molds that are in the ground, and then their body reacts to them, not enough to make them sick, but there's enough in their bloodstream that their immune system fires a reaction to it. The B cells fire a reaction, and you make antibodies against those things, and you strengthen the person's immune system, because the definition of a strong immune system is you have a lot of circulating antibodies against a lot of things. And when we live in such a sterilized environment, and we've sterilized our atmosphere, and we're not exposed to small amounts of toxins, then you never develop antibodies against it, and you are going to be more susceptible to disease because of that. So there's my soapbox about speech about vaccination, but it's the same thing with exposure to mold. So I personally eat peanuts. I personally eat lots of mushrooms because I want that exposure to molds and toxins, so I develop antibodies so I don't end up with mold problems if I'm exposed to them in my house. So, or in the yard, or in the ground somewhere. So is it perfect? No, but I want circulating antibodies to mold. So, and other things. And so do you. That's the definition of a healthy immune system.
So if they tried harder, could they have come up with some other additives besides the toxic ones?
Oh, absolutely. So, and it's really not even trying harder. They do it. But the problem is that how do you make 10 million of them and send them out to the population? So the truth is, how do you know, a 6-year-old who's getting their smallpox vaccine or whatever they get at 6 years old anymore? We didn't vaccinate any of our kids. But if you're, how do you know? Every one of those 6-year-olds in second grade are getting the exact same dosage, whether they weigh, 110 pounds or they weigh 60 pounds. Because our healthcare system is so not personalized anymore, they're in a quandary. All right, we'll just put all this crap in there to hopefully stimulate immune response with everybody. So they're mass producing this stuff, and you can't mass produce. Back in the old days when the vaccines came out, they used to vaccinate someone and then they'd do a blood draw 2 weeks later to see if that person developed antibodies against the thing you vaccinated against. And if they didn't develop antibodies against, the vaccine didn't work. Well, guess what? They stopped doing that because most of the time the vaccine doesn't work. Why do you think these outbreaks of measles that took place in, every single year, which they blame the unvaccinated people, which to me is absolutely mind-boggling, and these outbreaks of measles occurred in the vaccinated population? Because just because you're vaccinated against something doesn't mean you developed antibodies. Therefore, you don't have immunity to that thing. So it's
I just have a hard time understanding why would they choose mercury when they could have used something else. Like, why would someone intentionally do that when they know it's harmful?
Well, because they need something that's a poison that will stimulate an immune reaction. So you have to put some sort of poison in there that will stimulate an immune reaction.
Okay.